Hello guys, so today's topic is fever and chills. Fever is a very important presentation. A patient has many different underlying diseases and he can present with fever. Fever can be associated with chills, and chills, the cause of chills can be are bacteremia, septicemia. Most of the times, the chills are present in these conditions with fever. Pneumococcal pneumonia, pyelonephritis, malaria, visceral abscess, lymphoma, and biliary sepsis, and in which we have Charcot's triad. In these conditions, most of the times the fever is associated with chills like teeth chattering and bed shaking. This type of state is called as chills. Now we have certain conditions in which the patient can have fever, like heat stroke. Heat stroke is actually a sudden hot, dry, flushed skin due to um, uh, due to a rise in temperature of more than 40 degrees centigrade, and the patient is having rapid pulse and confusion and altered level of consciousness. It is a very lethal condition. It can lead to circulatory collapse and then death. The management of heat stroke is that we have to immerse the patient in cooling water and apply ice packs. And the preventive measure can be the patient that you should not, and the individual should not go outside and when the temperature is very high, like more than 40 degrees centigrade, especially in elderly patients. They are at a very greater risk of heat stroke, and the body and the body reacts immediately to a raised temperature with heat stroke. Then we have malignant hyperthermia. Malignant hyperthermia is actually a hereditary condition, and it is usually noticed in during major surgery. If the patient is undergoing major surgery and he rapidly develops hyperpyrexia, muscular rigidity, and acidosis. So we can say that the patient has malignant hyperthermia. Febrile neutropenia, it is a condition. It is usually noticed in cancer patients who are on cancer therapy, and the resulting state is neutrophils get decreased of less than zero point 0.5, and due to which the patient has increased temperature of more than 38 degrees centigrade. So the we say that condition as febrile neutropenia. In the patient who is on chemotherapy, we should investigate the causes of fever. But if other causes are excluded, then no other causes found, then we can say that our neutrophils are decreased. We can say that the patient has febrile neutropenia, and it is usually seen in chemotherapy patients. Factitious fever. Factitious fever is a condition in which people fake fever, like people are attempting to malinger, and usually the people who are hospitalized, and we are going to suspect that the patient is having factitious fever when all the readings and the series of readings and are have all the series of readings have high temperature with atypical flu and excessively high temperature of more than 41 degrees centigrade, and the fever is unaccompanied by other fevers like the fever is associated with tachycardia, and in this condition patient may not have this sign, and the absence of diurnal variation, and usually people do this by dipping the thermometer in warm water and contact with bulb. So this is called as factitious fever. Then we have neuroleptic malignant syndrome. Neuroleptic malignant syndrome is seen in patients who are on antipsychotics, especially on haloperidol and lithium carbonate. And the symptoms of neuroleptic malignant syndrome are high temperature, muscle rigidity, autonomic dysfunctions, and altered consciousness. And it is a fatal reaction to antipsychotic drugs. The drugs should be immediately stopped in neuroleptic malignant syndrome. So, if the fever is less than 3 days, it is usually the self limiting fever and it is usually due to viral infections. mostly. And if we investigate and take the history, the condition is viral and there is no focus. The condition is seems to be viral and there is no focus of infection found. Then in adult females, we can order urine examination. In children and females, we can order urine examination because the fever can also be due to UTI. And if the fever is lasting for 4 to 14 days, it is less common infections are suspected. In such fevers, less common infections are suspected, and the patient can have fever of unknown origin. Now, patterns of fever, there are different patterns of fever. Like intermittent pattern is the fever rises for a few hours and then returns to normal. The relapsing fever is that the fever returns to normal for days before rising again. Fever returns to normal for days before rising again, like malaria. And remittent fever, it returns towards normal for variable period, but always elevated. It does not touch the baseline. It returns to normal for variable period, but it is always elevated. And remittent fever is usually when there are large collections of pus, abscess. Remittent fever can be present in these conditions. Undulant fever is that there are bouts of continuous or remnant fever for several days, which is followed by afebrile remission for variable number of days. And it is seen in brucellosis, Hodgkin lymphoma, like conditions. Then we have continuous fever. Continuous fever is seen in viral conditions like influenza. Quotidian fever is fever recurs daily. Morning spikes, if the patient has morning spikes, the organism can be pseudomonas, and if they are afternoon spikes, there can be CMV, cytomegalovirus, and if they are evening spikes, we can say that there can be collections of pus like in gallbladder. So if we see the fever in post-operatively, that is the 24 hours after surgery, the causes can be atelectasis, hematoma, DVT, myocardial infarction, allergic drug reactions, and transfusion reaction if the patient is undergoing one. Fever in children causes can that cannot be missed in children are UTI, pneumonia, meningitis, septicemia, osteomyelitis, septic arthritis, pertussis, abscess. And the complications of fever in children are dehydration, and a very fearsome complication is febrile convulsions. And these are common up to the age of 5 to 6 years, from 6 months to 5 to 6 years of age. And it is due to the rapid rise in temperature. Even in infant, we are going to treat the infant expectantly if the child is well and there are no risk factors. And the only test we are going to order is urine microscopy and culture, because the patient can have an underlying urine tract infection due to which he is having fever. Fever in elderly, most of the times in elderly the thermoregulation system is impaired and they may not develop fever in suppurative infections. They show other symptoms like confusion and tiredness and discomfort. Any fever in elderly is significant because viral infection is most of the time less common cause in elderly, and fever in elderly is sepsis until proven otherwise, because they cannot tell you the specific problem that is going on with them. So we are going to suspect, and the elderly patients who are mistreated and who are not taken who are not taken care of, they are they are prone to develop certain infections. So we are going to label the fever in elderly as sepsis until proven otherwise. Now we have fever of undetermined origin. And what is the criteria to diagnose this? That the illness is lasting for 3 weeks and the fever is more than 38 on several infections, and the patient is undiagnosed after 1 week of intensive study. What are the red flags we have to see in if the patient has fever of undetermined origin? That the temperature is higher fever and there are repeated rigors, there are drenching night sweats, severe myalgia, severe pain anywhere, severe sore throat or dysphagia, altered mental status, incessant vomiting, unexplained rash, jaundice, marked pallor, tachycardia, tachypnea, fever which is lasting for more than 6 weeks and it is mostly non infectious. So, these are the red flags we have to look for when the patient is coming to you with fever. So, in the fever of undetermined origin, we have to follow a diagnostic model. First of all, we have the probable diagnosis. What can be the probable diagnosis? The patient can have pyogenic abscess, hidden pyogenic abscess, pneumonia, and EBV mononucleosis, viral upper respiratory tract infection, and urinary infection. What are the serious disorders which should not be missed? Can be vasculitis like giant cell arteritis, polyarteritis nodosa, polymyalgia. In infections, the patient can have HIV, malaria, zoonosis that can cause a fever of undetermined origin, typhoid, TB, osteomyelitis, chronic septicemia, infective endocarditis, Lyme disease, syphilis, and some cancers can also present as fever like a chronic fever like lymphoma, leukemia, and solid carcinoma of the lung and kidney, disseminated cancer, and some autoimmune diseases also have a chronic fever, and they can also come under the fever of undetermined origin. What are the pitfalls? Pitfalls usually the disorders that easily get missed are connective tissue diseases like rheumatoid arthritis, lupus, and sarcoidosis. And these conditions get easily missed if the patient is coming to you with fever. Some glossary terms like bacteremia. What is bacteremia? Bacteremia is the transient presence of bacteria in the blood, and it is in local infection and the trauma. What is septicemia? Septicemia or sepsis, it is the multiplication of bacteria and fungi in blood which cause SIRS, systemic inflammatory response syndrome. What is the severe sepsis? Severe sepsis is the sepsis with organ dysfunction. And what is the septic shock? Sepsis with critical tissue perfusion causing circulatory failure that does not respond to IV fluid administration. That is called as septic shock. So this is it. We have completed the topic of our fever. If you have any queries, kindly ask in the comments. And if there is any specific topic you want me to make video on from John Murtagh, please let me know in the comments. Thank you.